So the National Care Service, we have heard from Baroness Casey this morning around her commission and how that's progressing. Minister, could you give us an update from your perspective around your vision for this service and any further detail that you can provide at this time?
Yes, thank you very much for the opportunity to speak with you today. We are absolutely committed to creating a national care service. It of course needs to be fleshed out and further defined. As things stand, I see it as having three main planks. One is around the quality of care. One is around choice and control, so that the person who is the recipient of care has that sense of choice and control. And the other is about better and joined up services, particularly around integration. So I guess you could summarize it as quality, control and integration. And if we can get to a national care service that is based on those three driving principles, I think we will be in a much better place. Now the question is, the government has not been sitting on its hands and waiting for Baroness Casey to flesh out those three core principles. We've been working very hard by delivering £4.6 billion of additional funding to social care local authorities, 1.6 billion this year, rising to 4.6 by 28-29. We're delivering the fair pay agreement. We've given unpaid carers the biggest increase in carers allowance since the system was created in the 1970s. We're working at pace on the digital social care record. We've got a neighbourhood health strategy, which is about primarily, I would say, about preventing avoidable admissions, getting services far more joined up at a local level upstream. So there is a range of work that's ongoing whilst Baroness Casey is developing that fundamental strategic rethink.
Great, thank you, Minister. That's a good succinct summary to start with, and my colleagues will come in on various parts of that. My question is around integration. When Baroness Casey was here, we were discussing the issues that we all are aware of around the health service and social care working effectively together. Could you discuss what the government is doing at the moment, notwithstanding the Casey review, to address those issues, those structural divides, and how we're moving forward, particularly in light of perhaps the NHS bill, ICB restructuring, local authority devolution, reorganisation? Perhaps you could talk about the steps that are being made at the moment.
Yes, thank you. And I listened with interest to the discussions about ICBs and the role of local authorities. And I want to say that the guiding principle for everything we do is about integration. It's almost as if you could talk about a fourth shift. In the 10-year plan, we talked about hospital to community, sickness to prevention, analog to digital. I think there's a fourth shift, which is from fragmentation to integration. So let's be absolutely
arguably quite
clear.
Difficult, Minister.
It's difficult to do, and the old saying is, culture eats structure for breakfast. So you can do as much restructuring as you like, but fundamentally we have to change the culture, and the culture is that there's too much dominance by acute trusts. We've got to do the left shift. That means giving local authorities a really strong voice on adult social care. It means giving GPs a strong voice on primary care. Community health providers have to be at the table. That is why we've got our neighbourhood health strategy, and that is going to be driven by the health and wellbeing boards. And I think
Understood, Minister. Yeah. I understand. Just coming to that point, because my colleague raised this earlier, one of the sometimes the devil's in the detail, one of the issues that Baroness Casey did raise is within the NHS bill, our local authority colleagues are now no longer statutory appointees on the Integrated Care Board. Given what you've said about the fourth shift integration, do you think that's something that should be reconsidered?
Well, what I would say is what the NHS bill actually does is create much stronger integration between ICBs and strategic local authorities. So there is going to be a very strong role for local authorities, but articulated through strategic local authorities and the mayoralities in particular. That's about scale. It's about then enabling a much larger population oversight through this integration. And that, I think, will be a good thing in terms of providing better strategic commissioning and more joined-up services. But what I would say then, at a more, if you like, operational level, at the coalface, the health and wellbeing boards are responsible for bringing together all the key players. Local authorities are absolutely central to the health and wellbeing boards, and they will be driving forward the integrated neighbourhood teams so that we've got those joined-up integrated services at neighbourhood
Understood,
level.
Minister, understood. So the health and wellbeing boards, they've been pretty patchy to date in terms of how effective and how much power they've actually had. Arguably, the structure that you're describing is, in effect, social care sitting in the unitary authorities, reporting into health and wellbeing boards, and then health and wellbeing boards having some sort of reporting into integrated care boards, TBD. That feels like we're removing that direct strategic input from the social services themselves. I absolutely appreciate strategic authorities, very welcome, but social services, as I understand it, unless you want to tell me differently, will sit at a unitary authority level.
Well, the ICB, with the local authority voice in terms of the strategic planning as articulated through the NHS bill, will be at strategic local authority level, unity authorities as you describe them. The key point is, how do you get the best possible connection between strategy and delivery? And our view is that you do that with a strategic overview of population size of up to 1.5 million, which is what we're going to do through the giving local authorities that voice on with strategic local authorities. And then we're going to have...
Just to be clear for the people listening, because I think it can get a bit confusing, what we're talking about as a unitary authorities, but then strategic authorities are with a region. So, for example, in my area, we're going to have Sussex strategic authorities and then 4 or 5 unitary authorities. So they are different. A strategic authority is not the same as a unitary authority, which is the unit of delivery where the social care services will sit.
Yes, that's right. So what we are saying is at the strategic authority level, that is where local government will have its voice in terms of the overall planning and strategic development.
Okay, and forgive me, Minister, for social care, how will that work? Because the directors of social care will sit in the unitary authority, the health and wellbeing boards will sit in the unitary authority. So at strategic authority level, where is the social care voice?
Yep. Well, that will be through the strategic, through the mayoralty, who will have the overall strategic role of bringing together all of the unitary authorities. And I don't think we're prescriptive about who the mayor should appoint to that planning and strategy process. That's going to be up to her or him.
It feels like there might be some technicalities, which I appreciate, but the strategic authority, just be very clear again, the strategic authority will have a mayor, granted, for the most part, not in all places at the moment, and then there will be a board, which essentially will be the unitary authority leaders and deputy leaders. They will hold the mayoralty to account. That is political leadership, great. But there's a strategic piece here where the directors of social care will sit in the unitary authorities. Are you suggesting that there will be a social care director in the strategic authority?
Yes.
Okay. Thank you for clarifying that. No further questions.
Forgive me, Minister.